Hi, I'm going to talk to you about induction of labour. There are different reasons why women need to be induced. Sometimes there's a clinical need, such as gestational diabetes, your baby might be growing a little bit big, or the opposite, your baby might be growing a little bit too small. These are called clinical indications, and your obstetrician will be able to develop a plan of care with you with regards to your induction. For some women, in low-risk situations, sometimes their labours don't start. We allow your pregnancy to progress for up to about 10 days post your due date. You'll be assessed by an obstetrician who will discuss an induction of labour with you at this stage. There are two types of induction process. There's a prostin pessary, there's prostin gel, which acts to soften up your cervix, shorten it, and make it open up a small little bit. The pessary is given in behind your cervix and it stays in for about 24 hours. You will need to stay admitted into hospital while you're actually having this started. After 24 hours, it's removed and hopefully it's done its work and your cervix is opened up a little bit for them to be able to break your waters. While you're actually inside in the hospital, we'll have to do monitoring of the baby just to make sure the baby's happy. For the prostin gel, that tends to be given every 6 hours. Again, you're admitted to hospital, but it doesn't mean you're going to have your baby straight away. We give the gel, we allow 6 hours, and then repeat it again. Some women need 1 gel, other women need up to 3 gels, or even 4 in some situations. Again, this will be discussed with you at each stage. You'll have an obstetrician involved in this, and we'll be monitoring your baby closely to make sure the baby's happy and you're happy. That's why sometimes the induction of labour can take a couple of days to get you into labour. Once the gel has done its work and your cervix has softened up a little bit and has opened, the obstetrician will try to break your waters. Once they have successfully broken your waters, we'll encourage you to walk around for a couple of hours. We do this so that to try and encourage your body to start developing contractions themselves. This is a very important part of the process. We encourage you to walk, stay upright, if you have a birth ball to use that, and to stay in upright positions to do your best to allow your uterus to start developing contractions. After 2 hours, we'll do an assessment. We'll do a tracing of the baby and make sure the baby's happy, and we'll assess what your contractions are like at this stage. Sometimes the contractions aren't effective and we need to start a drip. This drip goes into an intravenous cannula in your hand and it's called syntocinon. Syntocinon is given intravenously into your vein. It's a synthetic version of the oxytocin that your body would normally release in labour. We give it an infusion, we start low and we start bringing the infusion up to start getting effective contractions. While you're on this, you'll have to be on continuous monitoring. All the pain relief options are available to you at this stage. You will have to be on a continuous monitor to see how your baby is reacting to the contractions that you're having. You can stay upright and mobile if you choose at this stage, and there will be a midwife with you at all times, so you'll be able to discuss pain relief with them and positioning while in labour.